A recent report on COVID-19 deaths in Erie County has sparked more controversy over the effectiveness of vaccines. The data showed that 15 people died of COVID-19 and 10 of them were vaccinated. Some people say this proves that vaccines are not working. One local infectious disease specialist, though, says that information is misleading. Brian Wilk joins us with the story. Brian.
That's right, Jill. The doctor put together a longer and more accurate study. Dr. Howard Nadwarney says those reported cases were from August through February, and most were elderly patients who died at home. He realized that information did not reflect what we were truly seeing with deaths. So he compiled COVID information from the Erie County Health Department from August 1st on, because that's when Delta first showed up in Erie County.
It peaked in November, December, and then faded away in January. But I thought that since the deaths were reported from August on, that if we actually looked at the total number of deaths during that same period, it would give a better perspective on the effect of vaccination on the risk of dying.
He says the data shows 2/3 of the people who have died from COVID were unvaccinated, and just 1/3 were vaccinated.
The people who were more likely to die who were vaccinated were older, so they were frailer, they had multiple medical conditions.
So they didn't go to the hospital to get aggressive care, but the young people who died at a higher rate were unvaccinated, and just about all of them came to the hospital.
I thought that it was important to give some perspective. The vast majority of people who are dying from COVID in Erie County are unvaccinated.
He adds those reported deaths got into the system much later than they occurred, and you have to look at all the information to get the whole story. Getting vaccinated also shows it prevents long-term chronic symptoms. The doctor adds about 2 to 5% of people who have mild COVID under the age of 65 reported significant health problems just 6 months later. Jill?
Okay, Brian, thank you.